Hello, my name is Dr. Dewan S. Raja. Today I will discuss about scleroderma. Scleroderma is a rare and chronic autoimmune disease that causes hardening and tightening of the skin and connective tissue. It occurs when the immune system mistakenly triggers excess collagen production, leading to thickened skin and in some cases damage to internal organs like that of kidney, lung, heart may be affected. Blood vessel will get telangiectasia and there will be constriction of the blood vessel and there will be dysmotility in the digestive system and also the disturbance in the sphincters. Picture of the systemic sclerosis, scleroderma. We are seeing the changes here. This is an autoimmune condition that affects the skin tissue. Types of scleroderma. If you go to the classification, localized scleroderma primarily affect the skin and sometimes underlying tissue like muscles and bones. Morphea, patchy, discolored, hardened skin. Linear scleroderma, bands or streaks of thickened skin, often affecting limb or the face. Systemic sclerosis, systemic scleroderma, affect the skin and internal organs. Limited cutaneous systemic sclerosis, we may get also Crash syndrome like cutaneous calcinosis, Raynaud's phenomenon, esophageal sphincter disturbance, and telangiectasia syndrome. We're getting gradual skin thickening on the fingers and face, along with possible lung and digestive issues. Diffuse cutaneous systemic sclerosis, rapid skin thickening over larger body areas, and higher risk of organ involvement like lung, heart, and kidneys. So this is an image from Robin's cotton pathologic basis of disease. We are looking at the normal skin here. We have the epidermis, dermis, some hair follicle. Here there is no hair follicle. Dermis is very thickened with inflammatory substance. Inflammatory cells are here. Okay. And there will be decreased blood flow. There will be thickening of the skin. There will be skin damage. Okay, extensive subcutaneous fibrosis has virtually immobilized the finger, creating a claw-like flexion, deformity, loss of blood supply has led to cutaneous ulceration. We are seeing ulceration here. Okay, so these are the features of scleroderma. So here, no hair follicles. Paucity or maybe very rare and thickening of the dermis. We have also inflammatory cell here. Okay, if you look at the image here, here is the faces of scleroderma, how it look like pinched nose, very thin lip, eyelid cannot be folded. Okay, tightening of the skin in the face, so much tightening, it is difficult to take care of the teeth. Okay, and also the scleroderma may be associated with Sjogren syndrome. So there will be decreased salivary secretion plus lacrimal secretion, and there may be chance of dental decay in scleroderma. Okay, we got that. Here, there will be prominent skin pigmentary changes, both hyperpigmentation and hypopigmentation. Scleroderma anterior chest demonstrating salt and pepper hypopigmentation here. Okay, and diffuse hyperpigmentation. Okay, this is the feature. This feature may be found in many cases of scleroderma. Okay, we got that. Now, if we go to the symptom, skin hardening, thickening, and tightness, and certainly we may get pigmentary changes, what I have seen in your previous slide, Raynaud's phenomenon, finger, toes turning white or blue in cold, joint pain and stiffness, digestive problem, acid reflux, because the esophageal sphincter does not work, decreased peristalsis that may lead to either diarrhea or constipation, and difficulty swallowing because of scleroderma, shortness of breath, lung involvement, swallowing difficulty, maybe esophageal sphincter problem also, shortness of breath, lung involvement, kidney, heart, lung complication in severe cases. So this is the Raynaud phenomenon. Finger become white due to lack of blood flow, then blue as the vessel dilate to keep blood in tissue, finally red as blood flow return. This is Raynaud phenomenon. People may have this problem if they are exposed to cold. Okay, that may happen. This is an autoimmune phenomenon. What is Krebs syndrome? We just discussed previously. It has this component, calcinosis cutis, Raynaud's phenomenon, esophageal dysmotility, sclerodactyly, and telangiectasia. Telangiectasia. Okay. So that is the red color blood vessel, thin blood vessel found under the skin. There will be capillary damage also. Causes and risk factor. Exact cause is unknown, but likely involves an autoimmune response. Genetics is the important factor and also environmental trigger. More common in women, 4 times more common in women than men. Usually diagnosed between the ages 30 to 50. Diagnosis by clinical examination of the skin changes, blood test for autoimmune markers, imaging, X-ray, CT scan for lung tissue, organ function test like kidney function test. Okay. Treatment of scleroderma. There is no cure, but treatment help manage symptom and slow progression. Medication, immunosuppressant, anti-inflammatory drug, blood pressure medication for Raynaud's kidney issue, proton pump inhibitor for acid reflux, because we have problem in a patient with scleroderma with esophageal sphincter disturbances. Physical therapy to maintain flexibility and prevent contracture. Lifestyle changes, skin care, avoiding cold exposure, exercise and healthy diet. In severe cases, lung or kidney transplant, specialized treatment like stem cell therapy may be utilized. And that's all about scleroderma. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.